The causes of autism are currently not known, but significant numbers of studies are underway with a view to learning how it develops. Researchers have identified several genes that appear to have connections to ASD. Sometimes, these genes arise by spontaneously mutate. In other cases, people may inherit them. In studies of twins, autism often has a strong correlation between twins. For example, if one twin has autism, the other is likely to have autism an estimated 36 to 95% of the time, according to the Nines. Autistic people may also undergo changes in key areas of their brains that impact their speech and behavior. Environmental factors might also play a role in the development of ASD, although doctors have not yet confirmed a link. However, researchers do know that some rumored causes, such as parenting practices, do not cause autism. Do vaccines cause autism? Another common misconception surrounding autism is that receiving vaccines, such as those for measles, mumps, and rubella (MMR), can contribute to autism. However, the CDC report that there is no known connection between vaccines and autism. There is no link between vaccines and autism. A 2013 study confirmed that the number of antigens, or substances that trigger the production of disease-fighting antibodies, are the same in children who do and do not have ASD. Some people claim that thimerosal, a preservative that contains mercury and is in specific vaccines, has links to autism. However, at least 9 different studies since 2003 have provided evidence that counters this claim. The Lancet journal published the initial paper that triggered the controversy around vaccines and autism and retracted it 12 years later after evidence of data tampering and research fraud became clear. Governing bodies stripped the author, Andrew Wakefield, of his credentials and permission to practice treatment. There is no uniform treatment for autism, as every person with the condition presents differently. Therapies and strategies are available for managing the health issues that often accompany autism. These issues can include epilepsy, depression, obsessive-compulsive disorder (OCD), and sleep disturbances. Although not all of these treatments will be effective for all autistic people, there are many options to consider that may help people cope. Autism specialists or psychologists can refer a person for a treatment that reflects their presentation of autism. Interventions. Among the treatment interventions that may be beneficial are Applied Behavior Analysis (ABA). In ABA, an instructor will first try to learn about the particular behaviors of the autistic person. They will also want to know about the effects of their environment on this behavior, and how the person learns. ABA aims to increase desirable behaviors and reduce harmful or isolating ones by using positive reinforcement. ABA can help improve communication, memory, focus, and academic performance. By analyzing current behaviors and teaching new actions step by step, an instructor can provide both an autistic person and the people around them with tools for support. Early Start Denver Model (ESDM). This type of behavioral therapy occurs during play and helps children between the ages of 1 and 4 years old. A psychologist, behavioral specialist, or occupational therapist will use joint activities and play to help an autistic child build positive relationships with a sense of fun. Parents and caregivers can then continue the therapy at home. ESDM supports communication skills and cognitive abilities. Floor time. This involves parents joining children in the play area and building relationships. ABA therapies might also use floor time to support treatment and vice versa. Parents let the children lead the game, allowing the child's strengths to develop. Through this engagement, an autistic child will learn two-way and complex communication, emotional thought, and intimacy. They also learn to take the lead of regulating themselves and engaging with their environment. Occupational therapy (OT). This helps an autistic person develop the skills for everyday living and learn independence. These skills include dressing without assistance, basic grooming and hygiene, and fine motor skills. Autistic people can then practice these skills outside of the therapy sessions, which are usually 30 to 60 minutes long. Pivotal Response Treatment (PRT). This therapy aims to support motivation and the ability to respond to motivational cues in autistic children. It is a play-based therapy that focuses on natural reinforcement. Many therapies for autism revolve around helping caregivers and teachers provide support. For example, if a child wants a toy car and asks for it in an appropriate way, they get the toy car, not an unrelated reward, such as candy. This also encourages autistic children to start social interactions, instead of just responding to them. Relationship Development Intervention (RDI). This treatment centers on the importance of dynamic thinking, or the ability to adapt thoughts and process situations flexibly, to help improve quality of life in autistic people. The focus of RDI includes understanding other people's perspectives, processing change, and absorbing information from several sources at once, such as sight and sound, without experiencing distress. Speech therapy. This helps address the challenges in communication that autistic people might experience. Assistance might include matching emotions with facial expressions, learning how to interpret body language, and responding to questions. A speech therapist might also try to teach the nuances of vocal tone and help the individual strengthen their speech and clarity. TEACCH. This program helps integrate the needs of autistic children into a classroom environment, with an emphasis on visual learning and support for the attention and communication difficulties that might arise. Special education providers and social workers, as well as medical professionals providing other treatments, such as psychologists and speech therapists, can use this system to support autistic children. Verbal behavior therapy (VBT). This helps autistic children connect language and meaning. Practitioners of VBT focus not on words, but the reasons for using them. Medications. If a doctor prescribes medicine for an autistic child or adult, they will usually be trying to address seizures, depression, or disturbed sleep. Again, medications may or may not be right for an autistic individual on a case-by-case basis. If you like more video, just subscribe.